Trying to navigate between two different screens here. Welcome everyone. I see the number of participants going up now a little bit, so I'll just start the meeting. Welcome to the last day of World Water Week. Welcome to this session on climate, AMR in a WASH and a One Health context. This meeting is a collaboration between a group of hosts and befriended organizations who have been working in this topic over the past couple of years, including SIVI, the Stockholm International Water Institute, SIDA, the Swedish International Development Agency, SIANI, the Swedish International Agriculture Network Initiative, the Swedish Agricultural University, REACT, and Nordea. Thank you all for this collaboration. This session, as you see in the agenda, has two different main parts. We'll have some of this session in this central room, center stage, if we call it like that. We'll soon hear a brief keynote from Sabia Esak from South Africa and Alex Mung from World Economic Forum before we enter into the main interactive part with breakout groups, and I'll show you a little bit more about that in a second. And before reporting back and to allow some time for everyone to collect their notes and summarize the discussions a little bit, we'll screen a very short film, just a couple of minutes, that REACT produced, looking at children as a specifically vulnerable group to antibiotic resistance, before reporting back with all the facilitators from the breakout groups and ultimately closing remarks from Eric Vannant from the Rollback Antimicrobial Resistance Initiative from Tanzania. I'll tell you more about the speakers when we get to the respective agenda points, but I wanted to highlight already now that the breakout sessions are, of course, now that we can't meet in person, a bit of a challenge to ensure that everyone gets to the session they want to, while we also want to ensure a good mix of people and mix of experiences. So we'll have two rounds, and you can choose one of the rooms you want to have or you want to be in. And to do that, we'd ask you to rename yourself. So if you hover over your own window in the Zoom window, there will be 3 dots. And if you click on them, you can rename yourself. And just before your name, enter the number of the group you want to be in. And we'll have 6 groups. One on the, as you can see here in this list, but I briefly walk through it. The climate impacts on water and infectious diseases in AMR is number 1. Number 2, WASH, water, sanitation, and health as a containment factor for infectious diseases. And in this way, also, of course, learnings from the COVID pandemic. What are there learnings or findings that we can draw there in the work against AMR? Human health in the context of water, climate, and AMR. You see here's the 3 pillars of the One Health approach. Human health is number 3, animal health number 4, environmental health number 5, and last but not least, the 6th group on corporate responsibility facing AMR and climate change, number 6. So I'll remind you of this later. And if you can't choose, we will assign everyone. But if you have a choice, you can just rename yourself, and we'll try to build these groups accordingly and also ensure a good distribution of participants in each group. I'll stop sharing here. Welcome again. I see the number is still going up a little bit. That's wonderful, and welcome everyone. My name is Nikolai Schaaf. I lead the work on water and pharmaceuticals, including AMR, here at the Stockholm International Water Institute. And I'm very happy about this agenda today, where we brought together really a broad group of different perspectives to dive into this topic of a triangle, in a way, between water, AMR, and climate. History to this event is also that we came up with the idea already last year when World Water Week was unfortunately canceled in the full format, and we decided to postpone this event to this year. where the topic of the week has been slightly modified from climate, water and climate last year to the resilience headline this year. But still, I think the context here, health, water, climate, through an AMR lens, is really a multidimensional space where there's not a lot of experience in how these global challenges all play together, exacerbate each other, and also what solutions can be in a holistic approach that incorporates all of this. So without further ado, I really want to jump right into the agenda. And as you've seen from the agenda slide that I showed earlier, we'll have two keynotes at the beginning. And the first one is from Professor Sabia Estak, the South African Research Chair on Antibiotic Resistance and One Health. She's also professor in pharmaceutical sciences at the University of KwaZulu-Natal in Durban, South Africa. So that means that here we really, just by the titles and these assignments, you hear that here we have an expert who has been working in the water, environment, human health, animal health triangle for a long time. And when we Googled actually, what do we find about water, AMR, and climate? Her presentations were among the few things that actually popped up. You find, as always, a lot of meaningless results, but there we found like, okay, there's very few people who really have been diving into this topic. So we are very, very happy to have you here, Sabia. May I ask you to turn on your video and unmute yourself? And I believe you have also some slides that you wanted to share. Over to you, Sabia, and thanks for joining us.
Thank you very much, Nicola. Thank you for that kind introduction. Can you see my screen?
You can see it. Maybe you can turn into presentation mode.
Is it on presentation mode now?
Perfect.
Great.
Perfect.
Wonderful. So thank you very much. Distinguished guests, colleagues, ladies and gentlemen, good afternoon. I would like to thank the Stockholm International Water Institute for inviting me to be part of this important event during World Water Week. My presentation will cover climate change as the threat multiplier and its unholy alliance with AMR. I will briefly discuss the implications of worsening climate change and AMR on the Sustainable Development Goals, and then talk briefly about One Health mitigation strategies, which will be further unpacked in our breakout sessions. So I think everybody will recall that the Intergovernmental Panel on Climate Change released its 6th assessment report on the 9th of August this month, and the news was not good. Human influence has resulted in unprecedented increases in temperature, rising sea levels, escalating greenhouse gas emissions, and extreme weather, all of which are occurring at a much faster rate than anticipated. So let's begin with a quick refresher on climate change. Solar radiation reaches the Earth's atmosphere, and most of this radiation is absorbed by the Earth's surface, warming it. The Earth re-emits some energy as infrared radiation, some of which escapes back into space. Some of this infrared radiation is trapped by greenhouse gases, causing the Earth's surface to warm. Human activities are increasing levels of greenhouse gases, trapping extra heat and raising the Earth's temperature. Climate change, regrettably, did not lose momentum during the COVID-19 pandemic. 2016 to 2020 was the warmest 5-year period on record. Lockdown did not reduce carbon dioxide emissions. In fact, global fossil carbon dioxide emissions rose by 62%. Glacier and snowmelt threatens water supplies for billions. And droughts and floods produce the most impacts. So between 1970 and 2019, some 11,000 disasters were attributed to weather, climate, and water-related hazards, involving more than 2 million deaths and almost $4 billion in economic losses. Water-related events, either floods or storms, indicated in the blue and pink, were the most common. And this map shows you, I know it's really small, but this map shows you that no continent was spared. So climate change compromises the ecological and environmental integrity of living systems and enables pathogens to increasingly cause disease. The impact on aquaculture, fruit-producing animals, and crops threatens global food supply, food security, and food safety. Human activities associated with population growth and transport, together with climate change, increases antibiotic resistance and the spread of waterborne and vector-borne diseases of humans, animals, and plants. And climate change has thus been termed the threat multiplier. So AMR has formed an unholy alliance with climate change. So let's look at temperature. This study explored the role of temperature on the distribution of antibiotic resistance across the United States. The first figure is a heat map of antibiotic resistance for E. coli for all antibiotics. The second figure is a heat map of the 30-year average minimum temperature. They are almost mirror images of each other, as you can see from the color. This is a scatter plot of antibiotic resistance versus minimum temperature for E. coli and amoxicillin. And this last figure stratified this by antibiotic class, such that associations between temperature and resistance were strongest for the fluoroquinolones and weakest for the carbapenems. The study showed that increasing local temperature and population density were associated with increasing antibiotic resistance in common pathogens. The burden of antibiotic resistance could thus be significantly underestimated in the face of growing population and climate change. On a peripheral note, horizontal gene transfer was reported to be facilitated at higher temperatures among soil bacteria and fungi, potentially enhancing the spread of resistance. So the main greenhouse gases associated with anthropogenic activities are carbon dioxide, nitrous oxide, and methane gas, the latter associated with intensive food production, wastewater treatment, rice paddies, and constructed wasteland. According to the FAO, the Food and Agriculture Organization of the United Nations, livestock farming generates far more greenhouse gases than the global transport sector. Scary. The growing global demand for meat protein has resulted in the expansion of intensive food animal production systems and the escalation of veterinary antimicrobial use. This increased use exerts selection pressure for the development and/or the escalation of resistance, while intensive food animal production additionally increases the emissions of methane gas. So really an unholy alliance. In 2013, the global consumption of all antimicrobials in food animals was estimated at approximately 131,000 tons. These are the inner red circles. And this is projected to double, to almost double, to more than 200,000 tons by 2030, as denoted by the darker red border. So climate change is fueling AMR and vice versa. The climate report highlighted the fastest rates of sea level rise in 3,000 years, the lowest level of the Arctic sea ice in 1,000 years, an unprecedented glacial retreat in at least 2,000 years. With all of this melting, there have been reports of antimicrobial resistance genes being released from permafrost in Siberia and Alaska. Climate change is also causing ocean currents to move, and with them move these antimicrobial resistance genes. If I turn to this little blue slide, the impact of climate change on water causes water scarcity during droughts that can adversely affect hygiene and sanitation. Food scarcity can cause dietary shifts towards more unsafe foods, and contamination of crops by feces due to high levels of rainfall or flooding has a food safety and a food security impact. Additionally, antibiotics such as streptomycin, oxytetracycline, oxalinic acid, and gentamicin, all also used in humans and animals, are used for the control of bacterial diseases of plants, especially rice and fruit, and specifically citrus. Antibiotics enter soil and water systems by adsorption, rainfall, and irrigation. And these antibiotics exert selection pressure again for the emergence and escalation of antimicrobial resistance. So again, I say climate change is fueling AMR and vice versa. Both climate change and AMR will negatively affect the achievement of the Sustainable Development Goals. Climate change impacts include rising poverty, and I'm referring to this particular section here, food insecurity, health issues, water scarcity, damaged infrastructure, rising inequalities, displacement, ecosystem collapse, biodiversity loss, and conflicts. Almost all of the SDGs are implicated in climate change. While AMR requires unprecedented levels of global coordination, AMR puts the achievement of SDGs related to health, agriculture, animals, the environment, and food security at risk. In addition, actions and objectives related to these SDGs are closely related to individual AMR content areas. In addition, AMR puts the achievement of some SDGs indirectly at risk due to cascading impacts on economic well-being and inequality. So climate change, like AMR, can be termed as the quintessential One Health issue, and thus requires a One Health approach to address it. So the latest definition of One Health by the One Health Commission in 2019 is that One Health is a collaborative, multi-sectoral, and transdisciplinary approach working at local, regional, national, and global levels to achieve optimal health and well-being outcomes, recognizing the interconnections between people, animals, plants, and their shared environment. And this figure shows key climate change and AMR-related factors such as water pollution, air pollution, deforestation, biodiversity loss, disease vectors, intensive livestock, antimicrobial use, and food security. The Pan-European Commission on Health and Sustainable Development calls for the implementation of One Health in all settings where health policies are developed. It specifically called for an intergovernmental panel on health threats that would draw on the successes of the Intergovernmental Panel on Climate Change. It calls to operationalize One Health at all levels, take action at all levels of societies, especially for vulnerable and at-risk populations, make changes to the global financial system, promote global public health goods for sustainable improvements in health, and support innovations in health systems. The Global Risk Forum, based in Davos, proposed the integrative health risk management approach encompassing prevention, intervention, and recovery or rehabilitation at the interface of human, animal, and environmental health, with a strong link to food safety and security, as well as to agriculture. In the interim, there are calls for the revision of the international health regulations to address all public health threats, including climate change and AMR. So in conclusion, the mitigation of both climate change and AMR requires, firstly, unequivocal political leadership and commitment, strong global and local policy frameworks and governance, evidence-based One Health solutions, implementation research to adapt successful interventions to country contexts, and then coordinated, multi-pronged, multi-stakeholder, multidisciplinary partnerships that suspend sectoral interests for the public good. Climate change and AMR should leverage the political and public health visibility and gains made by each other and join forces for mutual benefit. I thank you for the privilege of your time.
Thank you very much, Sabia. Sorry, I had to find the correct window here. There's many windows between trying to keep an eye on the list of participants, which I see happily increasing, and listening to this fabulous overview. Thanks a lot. It really provides an insight in how several of the global threats or the main global challenges, some of them higher on the agenda than others, are actually intertwined, exacerbating each other, but also indicating how the solutions then obviously are interlinked. So although this called for a lot of follow-up questions, I'll ask everyone to hold these questions when we join the breakout groups. Luckily, Sabia will be with us and also chairing one of the breakout groups. Thank you very much for this. I'll move right on to the next speaker, and that is Alex Mung from the World Economic Forum, leading the water team. And while you see a lot of publications and obviously well-known conferences hosted by the World Economic Forum, we were really happy to see that they're also working in this field of water, AMR, and related pollutions. Very happy to have you here, Alex. May I ask you to unmute yourself and turn on your video?
Thank you very much, Nikolai, and thank you very much for inviting me to join this session. Very kind words there, and it's quite humbling to follow Professor Essick there. As you mentioned, she's quite the expert, and it was fascinating to hear that overview, and I would wish that I could just be part of the students that actually take her courses there. I will be the first one to acknowledge I'm not an expert. I'm on the opposite end of the spectrum, but what we here at the World Economic Forum, an important aspect of our work is to shine the spotlight on topics, often that are under the radar, but shouldn't, given their importance to our economies and our societies. We want to help bring them out from underneath the covers, so to speak, and raise awareness and spark conversation around these. And that's the reason why we're here as part of the water team of the World Economic Forum. We're focused on exploring this topic of AMR and water. For this reason, we actually commissioned a report working with Vivid Economics and our network of partners and stakeholders on this very topic. And in particular, what we wanted to explore are the economic and social impacts of specifically what I will call, or what I will refer to as waterborne AMR, the microbes and pathogens that have resistant genes and spread through water. You'll again note I'm not an expert, but as I learned more and more about this topic, the more urgency I feel this issue has. For me, and as you've outlined in the very beginning, Nikolai, AMR represents almost the perfect manifestation of the health, water, climate nexus, in which the risks and the impacts will only increase and accelerate. So what did we find out? We examined key trends on the sources of discharges and the socioeconomic vulnerabilities that mediate our exposure to waterborne AMR. And with conservative assumptions, absolutely waterborne AMR will have significant social and economic costs over the next 10 years. You mentioned this report. We released a summary of it today, and I'm just going to touch on a couple of these highlights, but do be in touch if you're interested to learn more. In terms of cost to people, from increased disease burdens on the duration and quality of life of those who suffer infections, this is measured by disability adjusted life years, DALYs, which represents the number of years of perfect health lost. The analysis that we did suggests that waterborne AMR will lead to 15 million DALYs yearly. Now, when I first heard that number, I was trying to wrap my head around that. What does that really mean? And I tried to put it in different terms. This is equivalent to every single person in Buenos Aires, Argentina, which has a population just shy of 15 million, losing 1 year of perfect health due to premature death or disability every year. Now, putting it into that context, it's almost mind-blowing already. If that was a cost to people, cost to healthcare systems, we estimated waterborne AMR will cost $1 to $5 billion per year in additional healthcare expenditures, which represents the short-term costs to treat these more stubborn diseases and the cost to manage the longer-term implications of being sick. Now, this $1 to $5 billion will only expect to increase as resistance further develops and as our populations grow. So already, this is quite a hefty price tag, and which concentrated in the global south, where many countries will not be able to afford this additional burden. The risks and the impacts here are astounding. The cost of the wider economy due to reduced labor supply and productivity, we estimate globally waterborne AMR will lead to 3.5 million additional sick days per year. Now, when you translate this into dollars, this is a cost, a price tag to the economy of approximately $300 million. So not insignificant numbers here, and especially this, the cost to the wider economy. The losses are concentrated in the agricultural sector, which does have a large share of unemployment in countries most at risk, and because of the greater reliance on labor inputs to production. So whether it's the cost to people and our livelihoods, our health, the cost to healthcare systems, cost to the wider economy, the numbers are actually quite staggering here. They're not insignificant. And again, they're concentrated into the global south because of the global trends of where manufacturing has taken place, the spotty sort of progress on wash, access to clean water, sanitation, wastewater treatment. And these are going to be very likely to have extremely hard impacts on countries. So in my mind, one of the big questions was, well, if these trends continue, how bad might it get for future waterborne AMR-driven pandemic scenarios? We actually looked at cholera as one example, a waterborne disease primarily spread through contaminated drinking water, and where already resistant strains to antibiotics were observed in Africa and in Asia. We looked at Bangladesh in particular as one potential hotspot for a waterborne AMR epidemic in terms of cholera, because of its lack of sanitation infrastructure, dense urban areas, large refugee population. So this whole cocktail mix of factors, and we're already endemic cholera causes 100,000 cases in Bangladesh already. So it's already there. It's already observed. Now, with an adverse but treatable outbreak, the estimates showed this might infect 350,000 people and actually kill 5,000 people. And that's an adverse, but it's a treatable outbreak. If we flip the coin, a resistant strain, based on our analysis, we expect a resistant strain could double the caseloads as untreated infections are prolonged and as secondary infections propagated through a lack of wash is extended. This also impacts the significant and raises fatality rates here. And when we looked at the statistics of other resistant strains and what the fatality rates were, we use an estimate fatality rate of 20%, which led to a very plausible outcome for a resistant cholera epidemic to result in 700,000 cases. So again, that doubling of the 350 cases expected of a adverse but treatable. So 700,000 cases doubled, and 140,000 deaths. Now that was compared to the 5,000. So just about 28 times higher than what a adverse but treatable epidemic outbreak would be. Now, when we looked at costs here, doubling the costs, which is in line with its extended duration, the double extended duration, this would lead to a $4 billion cost to the economy. Now, for Bangladesh, that is quite significant. And for many of the key sectors that it has, this would be a significant knock to its economy and actually could cripple it. Now, so in conclusion, I don't want to take up too much more time, but this scale and interconnectedness of the waterborne AMR creates a very complex issue to tackle. I wholeheartedly agree with Professor Essek on the need for a multi-pronged approach to this. And our paper is not meant to be comprehensive and the because we do understand and acknowledge the wealth of expertise and research that is out there. But what we wanted to do is actually shine a light on this topic and show the important role that water plays and the significant economic and social impacts that AMR in water can have. And we hope that this accelerates the debate, and we hope it spurs more research And we hope that we can help fill some of the knowledge gaps and support the raising of this topic to the top of the agenda, as you mentioned at the top, Nikolai. So with that, I'll wrap up, and I very much look forward to the conversation today. Thank you.
Thank you very much, Alex, and thanks for this overview. And I think also following the state of the knowledge in the research and academic space to complement this with the perspective of economic impacts, I think this is something that we haven't seen very much of so far in the AMR debate. So I think that's really something that also will trigger very much of how this challenge will be perceived globally. Thanks again. Moving on in the agenda, and as a reminder, I will also, if I succeed here, I will share my screen again. Since we're now moving to the breakout groups, and I would ask everyone, as I said initially, but I've seen many people joining us over the course of the first introductions, and I've seen a few people already started renaming themselves. We'll do breakout sessions, and it's a bit of an experiment, but we do hope it works, that for the first round, you can choose your group according to the topics here, and we go through them one by one now with the expert speakers introducing them. But do go, if you're in the Zoom window and you go over yourself either in the list of participants, there is a more button where you can rename yourself, or you go over your window, depending on what kind of view you have. There will also be 3 buttons. You right click or click on these 3 buttons and rename yourself. So just in front of your name, you'll add the number of the group you'd like to be assigned to. We hope it works. Colleagues are working in the background and preparing these groups currently. And for the second round, we'll just randomly assign people to the different groups so that we also have a mix and expose everyone to maybe not their own fields of expertise. So while we're walking through these different topics, please do rename yourselves. I'll stop sharing to not take the space of the speakers, just a second. And I'll start inviting Sabia Esak back on stage. You'll be chairing the first group, number 1, on the topic you introduced in your keynote already, climate impacts on water and infectious diseases and AMR. The idea of this round now is that every facilitator of a breakout group gets a couple of minutes to introduce the topic. So you have an idea. Everyone should have an overview of how these things fit together. And then you can choose where you'd like to deep dive then in the breakout groups. We'll have 2 rounds of 20 minutes. And while people speaking, again, please do rename yourself. If not, we will just assign you to one group. That's also fine. But if you have a choice, please indicate that. I saw a few people did that in the chat. That doesn't help as much. Please do it in your Zoom name. Sabia, over to you.
Sure. So thank you and hello, everyone. This breakout session is, as Nikolai mentioned, on water, infectious diseases and AMR. I think I've covered quite a bit of it already. My earlier presentation provided an overview of the impact of climate change on water, infectious diseases and AMR. These are the causes and consequences. And just to recap, what causes climate change is rapid industrialization, energy use, agricultural practices, deforestation, consumer practices, livestock, transport, resource extraction, and pollution. The effects that climate change has is, again, rising temperatures, rising sea levels, unpredictable weather patterns, increase in extreme weather events, land degradation, loss of wildlife and biodiversity. And there's several impacts such as displaced people, poverty, loss of livelihoods, hunger, malnutrition, increased risk of disease, global food and water shortages. And the second little slide there is the CDC infographic on the impact of climate change and human health, highlighting water and vector-borne diseases, water and food supply impacts, as well as other non-communicable impacts on human health. So in the first part of the breakout sessions, we're going to go through the facts and knowledge, what we know and what we don't know, and what the gaps in knowledge are. And for the second part of it, when we speak about what kinds of policies or interventions we should put into place, I would like to bring this into the behavioral aspect. So climate change and AMR can be attributed to the behavior or practices of stakeholders, including but not limited to governments, organizations, communities, and individuals. These stakeholders have the capability, the motivation, and the opportunity to behave in a way that can either ameliorate climate change and AMR or exacerbate climate change and AMR. So if we look at the center of this wheel, we see that it has capability, opportunity, and motivation. And the red wheel around it speaks to the types of interventions we can implement. And these can be to educate, persuade, incentivize, coerce, train, enable, model, restructure the environment, or restrict. And then the gray circle describes the policy categories of the intervention, such as guidelines, legislation, service provision, etc. So this is an example of behavioral change levers for climate change and AMR from a paper entitled The Social Dilemmas of Climate Change and Antibiotic Resistance, an Analytic Comparison and Discussion of Policy and Implications. The intervention functions are either reward or punishment, and the policy categories are economic, legal, or informative. I'm not sure whether you can see this very clearly, but if you look at the first one, for climate change, the reward could be subsidies for fuel-efficient vehicles. For AMR, the reward could be financial rewards for reducing prescriptions of broad-spectrum antibiotics, whereas the punishment could be climate taxes for the use of fossil fuel, or the withdrawal of health fundings for healthcare centers with high rates of antibiotic resistance. And so the examples go on for legal as well as informative aspects. And again, it's the reward and the punishment that I used as levers for behavioral change. I know I have very little time, so I won't go into the detail. What we will try to do during our breakout session in session 2 is try to identify interventions that can change behavior that will assist an improvement in climate change and AMR. And if we have the possibility to try to put them according to this matrix, or then simply just speak to some of the different kinds of policies and interventions. So I look forward to welcoming you to my group. Thank you.
Thank you very much. Thank you for this overview. I will just leave this as it is and move on to the next group, number 2, WASH as a risk or containment factor for infectious diseases and learning from COVID. Here I'm very happy that my colleague here at CV, Isabel Alvarez Morillo, is joining me. She's part of our WASH team, Water, Sanitation, and Hygiene, and has been working with the analysis and also advising different governments on the COVID response and analyzing how WASH played out in the fight against the pandemic, which using the frequent term of the silent pandemic for AMR is, of course, an interesting learning to what definitely turned into, let's say, a headline pandemic. Isabel, over to you.
Thank you so much, Nikolai, and very happy to be here with you all. I don't know if you can see my screen. It's just a little small introduction to the team.
Yes, group. We can see it. Thanks.
Great. Okay, perfect. So just a small presentation for you all. The health emergency caused by COVID-19 has affected various countries in various degrees. Considering that hand washing and with soap and clean water is the most efficient way of preventing infections, many countries have implemented a set of measures to mitigate the effects of the crisis in relation to water, sanitation, and hygiene services, or WASH. So as Nikolai mentioned, CWE has conducted a mapping of the COVID-19 response in the WASH sector for 84 countries to understand experiences and good practices by providing a summary of the initiatives implemented worldwide to first, ensure that all people have access to safe drinking water, sanitation, and hygiene during the emergency, And second, support and strengthen the role of utilities in continuously and safely provide these basic services. So we found a lot of examples of hygiene promotion, fighting misinformation, hygiene supplies, provision, wash in healthcare facilities and isolation centers, for example, as well as a significant number of measures for ensuring continuity of water supply services for households less able to afford and facilitate the bill payments. I will present in this breakout room the results of the mapping that show how many countries have, for instance, established or revitalized multi-actor emergency coordination mechanisms, including international or multilateral organizations and other actors and other different measures. And based on this experience from previous crises, it is known that the capacity of the WASH sector to respond and coordinate with other sectors and be fully part of emergency coordination mechanisms have not always been successful. And as I mentioned, there is a critical importance of the WASH services for society in itself. And this has been demonstrated once again in this time of crisis. And we will need to use these learnings from this particular pandemic to be better prepared for the future shocks. So you can find both of our publications in the Files tab in the Pathable link to this seminar. And I welcome you all to join this breakout room. Thank you.
Thank you very much, Isabel, for a brief and concise overview. So this was group number 2, WASH. Number 1 was climate impacts. Just a reminder again to, if you are interested in a particular group, then please rename yourself by changing your name here inside the Zoom window. Also a good reminder, Sabia's presentation reminded me of the structure. We will generally look into first, in each group, what is there in terms of facts and knowledge in these different fields? And second part, what do we know about policies interventions? Both rounds will have this structure covering both ends. So number 3, and I see Philip has already started sharing the screen. Thank you very much. The first pillar of the One Health approach is human health. And even here, now we'll go through the next 3 groups, all the 3 pillars of the One Health approach, starting with One Health in the context of water, climate, and AMR. Philip Matthew is a director for, is from REACT in the Asia region, the Action on Antibiotic Resistance organization. I'm sure you have heard about it if you're interested in this space of AMR. Philip, thanks for joining you and for joining us, and over to you.
Thank you, Nikolai, for that wonderful introduction. I'll briefly go through what we are trying to cover in our breakout session. So me and my colleague Menning will be joining. So it's a slightly redundant because Professor Sabia Isaac has covered most of it. But just to reiterate, we are facing a problem of climate change right now with more and more extreme climatic events right across the globe. We are seeing more of climate migrants. We have seen a definite change in disease profile. So all of that is going to create a pressure on the healthcare infrastructure. So it can cause direct morbidity and mortality. It can result in large-scale climate migration and possibly lack of access to healthcare. A change in arboviral infection patterns are being observed right throughout the world. And as Professor Sabia was saying, temperature is a driving factor for AMR. So all of that will finally result in increased stress on the healthcare systems, especially in developing country context, which will eventually result in poor quality healthcare, access issues, and also utilization issues in healthcare delivery. So if you look at a broader perspective, more of a systems perspective, all of this can actually drive AMR, especially in low resource settings. So that is what we are concerned about here. Coming on to the water side of it and health, these are the bare essentials that we expect in any functional society. We expect households to have access to safely managed drinking water, an individual household latrine, optimal water and sanitation at healthcare facilities, all the waste being disposed using a well-functional sewage treatment plant, and of course proper treatment of sludge from sewage treatment. So if there is if there is a problem with any of the above, it will actually increase the rate of infections, the incidence of infection in the community, and drive antibiotic use, which will in turn drive antimicrobial resistance. So water and sanitation are extremely important. And the other facet of this is water should be seen as a disseminating factor, and wastewater is possibly an amplifying factor for antibiotic resistance. So water can actually disseminate all of this about. It can disseminate antimicrobial breakdown products, resistant genes, resistant organisms, and residues. So we should be concerned about water in that sense also. Potentially the contamination of water with antibiotic residues or resistant organisms, all that can be very detrimental to the health of populations. And on the other side of it is our wastewater treatment plants are not, at least whatever we have right now, most of it is not equipped to deal with resistant genes or breakdown products of antibiotics. So what we have essentially is we have all of these put together in all of the things that you see on the left side of your screen, put together in a common area, providing a very conducive atmosphere, or rather an environment for antibiotic resistance to develop. So effectively, our current wastewater treatment plants in many places act as genetic reactors which aid horizontal gene transfer. So all of this put together is causing an increased, possibly contributing to the antibiotic resistance crisis globally. This is actually from a document published by WHO, FAO, and OIE. So in that, you can see households and communities, they want to ensure universal access to safe drinking water and sanitation services. At the same time, healthcare facilities should also get clean water and enough provision for infection prevention and control. But then this is not as simple as we imagined before, because the level of investment needed to renew the water supply facilities, or to establish sewage treatment plants, or to even establish sewerage lines in developing country context, it is massive and much beyond the scope of the budgetary allocations in most of the developing countries. So how do we mobilize action around all these things which require massive investment? At the same time, climate change is actually causing a problem here. What we generally see, droughts in previously well rain-fed areas. At the same time, having extreme climatic events which destroy basic infrastructure in communities. So all of that put together, it's actually, we are entering some kind of a vicious cycle. So we'll be discussing about how to communicate this issue to various stakeholder groups. Who are the possible targets for communication efforts, and what should be the ideal messaging frames to various stakeholders. And at the same time, we want to, in the second part of it, we will probably be looking at the basic building blocks for a specific action agenda around this, and what are the possible strategies to advance WASH AMR agenda, and how can we actually look at climate resilient health systems, and who can be the possible allies in this fight. Thank you so much.
Thank you very much, Philip. Just a second. Thanks very much for that overview. That was group number 3, One Health, the human health angle. And the next one, group number 4, also under the One Health headline, animal health in the context of water, climate, and AMR. And I'm happy to welcome Christina Osbier from the Swedish University of Agricultural Sciences. She's a veterinarian who has been working and researching in the field of AMR, zoonotic, and emerging infectious diseases. So obviously a top candidate to host this breakout group. Christina, over to you. And thanks for volunteering to facilitate this group.
Thanks a lot, Nikolai. I haven't prepared a presentation, but I will just talk briefly about the group, where we will also, of course, discuss the knowledge, the gaps, and what interventions and policies that are required, with a focus, of course, on animals, both on terrestrial and aquatic animals. We know that animals are extremely important to reduce poverty and hunger. They provide food, but they also provide valuable nutrients that are extremely important, example for children and women of fertile age. They provide fertilizers, drought power, and also quick access to cash and comfort for the people that are rearing the animals. But of course, animals also pose a threat to global health security, both through pandemic threats, for example, the ongoing COVID-19, and also unsafe food and water and antimicrobial resistance. As we've heard by previous speakers, antimicrobial use is the most important factor leading antimicrobial resistance. And we know that the majority of the global use of antimicrobials are used in animals, and that this use, as we heard, is expected to continue to increase. Emerging antimicrobial resistance makes diseases in animals harder to treat, which is posing a threat to food production and to animal welfare. In addition, we have the threat of transmission of resistant bacteria and resistance genes to humans through multiple pathways, the direct contact with animals, animal waste, ingested food, and this transmission is often via the environment, and we need a One Health approach to tackle it. We will also talk a bit about climate change. Of course, it has a huge impact both on domestic and captive animals, on wildlife, on animal production and other cultural practices. And we need adaptive and resilient animals, animal production systems and health systems that can withstand climate shocks and infections. But there is currently a dearth of studies on the effects of climate change on animals beyond the infectious and vector-borne diseases. Animals do contribute to climate change that we just heard, but the impact of animal production on climate change can be reduced with healthier animals, since they are more productive and they generate lower emissions per weight. Also, well-managed animal production systems can have a positive effect on biodiversity. So it's not only bad for the climate. Climate change, infectious diseases, and antimicrobial resistance, as we heard, impact low and middle income countries disproportionately. In low and middle income countries, people generally live close to the animals and they're depending on animals for their livelihoods, but with limited access to infrastructure, sanitation, hygiene, and safe water. So interventions on WASH, infection prevention and control, and in particular biosecurity, have an enormous potential to reduce the One Health impacts of climate change, transmission of diseases, and the subsequent need to use antimicrobials, and also, as we heard, the spread of resistance. Some examples of WASH in infection prevention and control interventions that have been proved successfully, but others are, for example, to improve the water quality in aquaculture, safer management on animal waste, to enhance the slaughter hygiene, and also to prevent the sharing of water sources between people and animals. We will discuss this, and we will add some more interventions and also discuss the policies that can have a big impact. In the past, most WASH interventions have failed to address the risk that is imposed by the closeness of people living and working with animals. And that's why we will focus on animals in this group. The origin of COVID-19 pandemic, we don't know yet, but we know that very similar viruses have circulated in bats for the past decade. And also COVID-19 has highlighted the threat of neglecting animals and the threat that animals pose to emerging health threats. So we will really try to put animals into the center of WASH and making sure that the A in WASH stands for animals. Over.
Thank you very much, Christina. Sorry. Thanks for this compact overview. That was, I'm swapping through all my paper sheets here. So that was group number 4, animal health. And for group number 5, I have the honor of doing that myself, environmental health in the context of water, climate, and AMR. That is, of course, again, I keep saying that environmental health is something like a blind spot in the One Health approach to AMR. And actually, I felt confirmed in that diagnosis by, again, just Googling what happens if you type AMR, One Health, environment, climate, water into Google. And curiously enough, the first thing you get is this event, which is nice to see, but it also means that there is not a lot else. Otherwise, there's a lot of UNEP publications, which also is, I would say, symptomatic, because in the tripartite working with AMR, the environment is not strongly represented. UNEP is, of course, the key player in bringing these angles together. And I'll start in the group showing an illustration from UNEP that I think shows very nicely how water really is at one of the key factors when you look into environmental health and AMR. Looking at the water and climate lens, obviously, if you participated in other sessions during World Water Week, water and climate is so closely connected, both in the fields of mitigation, adaptation. Climate impacts are felt through water in many cases. These connections are obviously there, but not really well understood. I would say each of the bilateral relationships, climate, water, yes. Climate, infectious diseases, yes. You'll find quite a lot of data and research there. But closing that triangle is, there is not a lot. And to me, that circles a lot around the role of water and aquatic ecosystems as vectors and reservoirs, first for the antibiotics themselves, the active pharmaceutical ingredients, but then once resistance has occurred, once resistance genes have been triggered, then of course we are concerned about the prevalence and the fate and transmission of the resistance information between microbial organisms or then carrying the microbial organisms along. That knowledge appears really patchy, or rather, wherever you look, you find antibiotics in the environment. And that rather means that we're looking too little. The monitoring, both of the antibiotics and of the resistance gene is simply deficient. We know too little, and wherever we look, we find something, and we're well aware of certain hotspots with different characteristics. And then I think it's really important to differentiate where we talk about antibiotics in the environment and where we talk about AMR, because the antibiotics are, of course, of concern in those situations where we can reach concentrations that are high enough to to induce a selective pressure, so that the resistant organisms do have an advantage. But once we have reached that, of course, then we are concerned about the bacteria, and that can happen in the usage context in the healthcare facilities, but it can happen in the effluent or waste streams from pharmaceutical manufacturing. That different pathways that we're aware of. And that means also prevention physically means shutting off these pathways. Can we work through responsible usage? Can we work through better waste management, both in the clinical and healthcare context and in the manufacturing context? You're certainly all aware of this discussion, how far upstream, how far downstream do these interventions need to be implemented? But it's not that we don't know what to do. There's quite some toolbox available, but I would say bringing these different topics and the different policy fields together will probably enable stronger political action, also economic sensitivity to addressing these interconnectedness a bit more systematic. So that will be group number 5 on the environmental health part. And last but not least, I'm happy to introduce Maria Lettini from the FAIR Initiative and the Investor Actions Network on AMR. So here we're really happy to add a perspective that maybe in the keynote also was covered already in a way by Alex in the World Economic Forum. What's the corporate responsibility facing AMR and climate change and water risks? Is the investor community doing anything? We've had in previous sessions quite some focus on the pharmaceutical industry, but we thought this year we'd rather have a very broad perspective on this corporate responsibility, where of course investors have a leverage in providing economic incentives or other tools of sticks and carrots to influence other stakeholders. Maria Lettini, thanks for joining, and over to you.
Great. Well, thank you so much, Nikolai. I really appreciate the opportunity to participate in this dialogue. And so just as a reminder, as a bit of background, my name is Maria Lettini, and I'm the executive director of an organization called the FAIR Initiative, which may be new to most of you in this group. Just for context, we're a global institutional investor network. So we have 250 investor members whose combined assets now total over $40 trillion. So what we do essentially is produce research and data, analytical and practical tools for investors, as well as facilitate dialogues between investors and corporates on critical issues related to environment, social, and governance risk and opportunities. And they're related to intensive livestock production and plant-based protein alternatives. So we operate within that space, and obviously AMR is one of those critical risks. So we've produced several reports on AMR over the past 5 or 6 years for investors, so through an investor lens and a capital markets lens. And we're really focusing on the financial materiality of this issue. Our most recent report was released last month. If you're interested, it's called Feeding Resistance, Antimicrobial Resistance in the Animal Health Industry. And really, we're focusing on the role that the animal pharma sector has in potentially helping to mitigate AMR. Right. So just to give you again a little bit background, we'll be shifting a little bit the focus of the discussion in our group. We've heard from several stakeholders already who are engaging on this issue and how they're using their unique leverage to affect change on the critical issue. But and obviously all of the issue itself has been comprehensively laid out, sort of the impacts on the environment, on climate change, on human health, on animal health. And we know the potential impacts from a societal point of view, but the economic, business, and capital market outcomes also have very broad implications, which some of which my colleagues have already mentioned, which will affect productivity, financial stability, and the long-term value of global investments. So institutional investors like Nordea or BlackRock or JP Morgan manage large portfolios of assets, whether they are insurance assets or pension assets, and they need to make good financial returns in order to pay out insurance claims or pension liabilities when we retire, right? So company risk is deeply analyzed at institutional investors. And when investors identify a risk, they can then use their leverage as owners of these companies to engage in a dialogue to express concern about a company's operational practices, which they feel might impact the long-term profitability of their company and therefore their portfolios. So over the past 5 years, in collaboration with our investor members, we've done just that. Right. So we've spoken to companies about their role and responsibility to reduce and eliminate routine use of antibiotics in their meat and dairy supply chains. So if you could think, what if McDonald's had a corporate policy which instructed them to not buy any chicken or beef that had been routinely administered antibiotics, right? That in and of itself could significantly change food supply chains and the global animal protein sector. So we've laid out alongside our investors the business case for eliminating antibiotic use. And we've explained that we saw it as a long-term risk to their profitability and potentially a short-term risk to their reputations. So investors have engaged with corporations, in some cases building a real collaborative partnership to understand the key questions and issues around good antibiotic supply chain stewardship. And this has occurred, and many of you may know this, but it's occurred globally across the value chain. So, we and others have spoken to fast food chains and restaurants like McDonald's and KFC, like I mentioned, supermarkets, the animal protein producers themselves like Tyson or Maui or Scandi Standard, and straight across to the antibiotic producers or manufacturers themselves like Elanco and Zoetis. And so through this engagement and mutual understanding of material financial risk to profitability, we've seen a significant shift in their practices. And we've had companies make commitments to reduce and eliminate antibiotic use in their supply chains, many times well ahead of incoming regulation or legislation. So it really turns out to be a win-win. This also demonstrates to the market that the companies have an understanding of risk and a real understanding of where the market is moving. It also shows leadership and understanding of their role to avert global health crises. And it's also is a way of responding to global consumer awareness and preferences. And as I mentioned, importantly, gets them right ahead of any regulatory change. So in our session, we're going to explore further the utilization of corporate engagement and how corporates can be a leading lever in change. Again, in many cases, what we've experienced much quicker than perhaps even lobbying to institute for policy or regulatory change, although that's critical. At the beginning, I'll present an overview of engagement on this issue to kind of provide more context and share our own feedback. But really, we hope for any of the participants to share your own views about this approach. I'm sure many of you have engaged with corporates in your own roles to identify experiences or successes that you can share with others in this interactive discussion. So we hope for it to be very interactive and help us identify any further areas of sort of low-hanging fruit or success or even challenges that we can use our group of investor influence to sort of tackle this issue in the corporate sphere. So I'm group 6, Breakout 6. Hopefully you'll come and join us and bring your experience to share and your questions.
Thank you, Maria, and thanks for this introduction. So we will now distribute all participants into the breakout groups. My colleagues have been reading out how people changed their individual names. So let's hope it works. I'm not a Zoom expert, but I think it should play out nicely. The facilitators and also a support person in taking notes and keeping an eye on the time will be there with you. We have lost a couple of minutes now during the first half of the event. So we have shortened the breakout groups by 2 or 3 minutes, just a little bit to regain some time, because the disadvantage of this kind of setting is that the system will simply kick us out when the time is over. So we need to stick to that time, and I'll stop talking. Have fun in the breakout groups. Wishing you all a great discussion. And Iris, may I ask you to start the breakout groups, and we'll see each other here again in the main stage afterwards. Hello, everyone, and welcome back to the main stage. I hope you had good discussions. I am not sure about the...
I'm sorry, Nikolai, we don't have time for the second round because we have to do the discussion, the reporting back.
All right, we lost so much time before, and let me check on the agenda. All right, but then, yeah, I'm sorry we lost some time during the technicalities and during the introduction. Sorry if you're waiting for another round, but then I would say we can allow for all the facilitators and note takers in the breakout groups to have a few minutes to gather their notes. And may I ask Haura to start the video, because now we are sharing a video that raises a group. And for CV during World Water Week, it's important to address both the challenges of gender equality and youth empowerment, but youth empowerment is only works to a certain degree when we talk about vulnerable groups. We need to raise the voice or visibility of a group that is children who are usually not participating in this kind of conference. So I'm really happy for the video that React produced. Haura, please share whenever you're ready.
While the entire world is confronted with the rapidly unfolding COVID-19 pandemic, there is another slower pandemic spreading across the globe and threatening human health around the world. A threat which gets no headlines: the pandemic of antibiotic resistance. Antibiotics play a crucial role in all healthcare, and many of us take them for granted. But rapidly increasing antibiotic resistance threatens future care in the community and in hospitals. This is a growing global challenge. Especially children in low and middle income countries are at risk. Many of these children lack even the most basic health care, making the situation worse. Every third minute a child dies from sepsis due to antibiotic-resistant infections.
I think we've been through a period of tremendous drops and progress in reducing child mortality in the world. One of the key ingredients has been working and effective antibiotics, and those are now under threat, and that threatens gains both in the newborn and the older age period. We need working and effective drugs as part of our continued push to drive down child mortality.
This is Kiambu in the outskirts of Nairobi, Kenya. Children here, like in many African countries, are often affected by different kinds of infections, many of which are resistant to antibiotics. Pneumonia is still the leading cause of death for children under 5 in Kenya. Most of them do not get appropriate antibiotic treatment.
The fact is, in a few years to come, everybody will be in a problem, because we will not be having drugs that are responding to common infections. The doctors will not be having drugs to prescribe and treat to their patients because of drug resistance. I mean, it's a disaster for everyone, and it's important for the policymakers to ensure that the issues of antibiotic resistance is actually addressed as one of the causes of death in every country.
My name is Elizabeth Karangari Baburi. I'm a mother of 2 young boys, a 7-year-old and a 1-year-old.
Most parts of the world, when your child is sick and you have another couple of kids and you need to go to work and the health center is far, you go to the local pharmacy and you buy something over the counter.
When he has a flu but doesn't have fever, but I see the flu is constant there and it's not subsiding, so I'll just go over the counter, the chemist, and ask for medicine. I just think of anything and then I say, just give him this and that. But I don't feel that they don't necessarily think that it will work to the kids, or they just give it to give it, and then maybe after 1 week I'll come back and ask for more.
What we saw from Nairobi and Kenya here is very similar to what we see around the world.
In Southeast Asia, antibiotics are widely used for children as well as for the entire population. This is the capital Hanoi in Vietnam. Studies among children here shows that the majority use antibiotics every month. At the Vietnam Children's Hospital, staff are frustrated over the rising numbers of resistant infections that hamper their efforts to save the lives of the newborns. Every day, newborns die of sepsis at the clinic, and the situation continues to worsen.
Today we had to receive patients with antibiotic resistance every day, and the situation is difficult now and will be more difficult in the future.
At the hospital, the staff carry out an active infection prevention control program with measures such as careful hand washing, protective clothing, early detection of resistant bacteria through screening of the admitted children, and cohort care, with very good results, supported by the Ministry of Health.
We're in the COVID times now, and I think that's a fast and loud epidemic, but it has also shown that we can actually come together as a world. Now, we have a slower and faceless epidemic in antibiotic resistance. We need the same solidaric response in the world to come together now, to actually develop new drugs, actually maintain the ones we have, the current ones. We need to fix good access to quality healthcare for everyone, and we need leadership.
Antibiotic resistance must be pushed higher up on the global political agenda. Unless work to address this current crisis is quickly sped up, even more children will die from infections that cannot be treated. The entire world mobilized quickly against the COVID-19 pandemic. Now the global community must come together once again and do the same for antibiotic resistance. Funding of this crucial work must be allocated. Action must be taken now. We cannot afford to wait.
Thank you for sharing this video, Haura, and thank you, React, for contributing with this video. I think it really adds perspective in terms of why are we talking about this? What is the challenge here? Sorry for the delay. It's what happens when you lose a minute here and there. So we had to skip the second round, but I can say from my own group, it was a really interesting discussion. I hope it was the same in the other groups. So I will simply ask all the facilitators of a group to start with a very brief recap. And depending on the time, we might have time for one round of comments once we have heard everyone and looking at the bigger picture. But let's start with a quick overview of what has been discussed in your groups, starting with number one, climate impacts. Sabiha.
Thank you, Nikolai. So the first session we focused on what is known and what is not known and what the gaps are. And specifically, we said the climate change actually changes the distribution of pathogens and vectors, and this is going to affect the types of antimicrobial treatments that we require for therapeutic purposes as well as prophylactic purposes. And we know that the pipeline is almost dry, so that brings in the AMR aspect of it. We said that the WASH infrastructure is built for what was perceived as projected weather changes, and they are woefully inadequate for what we're seeing now in terms of changing weather patterns, hurricanes, floods, extensive rainfall, etc. And these inadequate WASH infrastructure is actually also increasing the risk of contamination with pathogens because it becomes overwhelmed by not being able to cope with the varying patterns. An interesting point was made that as much as we talk about planes, trains, and automobiles, they're also the ships that actually carry water from one continent to the other, and they discharge it all along, spreading whatever is in the water, pathogens, chemicals, antimicrobial resistance genes, mobile genetic elements, and take it all along the sailing path, if you like. Wastewater treatment plants are not really equipped to remove all of the bacteria and as well as the residues. And then we need further research to unequivocally link AMR, climate change, and WASH. And then finally, the big question is, why must we wait until it's a crisis stage before anybody takes action? The second part of our discussion related to what are the policies and the interventions that we could put into place. And the first point we mentioned was that mitigating climate change, antimicrobial resistance, and WASH all require a social sciences, behavioral change, and implementation research lens. We have to make a really strong investment case, a strong policy case, and make sure that both of them are going to be really well monitored and evaluated. We want to bring together and ensure coordinated efforts by climate change practitioners, AMR practitioners, and WASH practitioners. Each should leverage the gains and the visibilities, show the alignment and how mitigation in one sector is going to advantage mitigation in the other sector, and really start working together. So just like AMR, climate change, and WASH, they all require the whole of society intervention or engagement, from the policymakers downwards and from the community level upwards. And education is key, but the education has to be tailored to the health literacy levels of the people. What applies in high-income countries may not necessarily apply in low-income countries. And we really should guard against fear-mongering, but rather take a harm reduction strategy. So if you do this, you will reduce the harms to yourself and your immediate family and your immediate community. And then we need to build local capacity such that known and proven interventions and solutions can be adapted and contextualized to the local situation. And then obviously we have to leverage COVID. Everybody now knows what a pandemic is. So if we can show that AMR is a pandemic that has such far more reaching ramifications than COVID. It affects humans, animals, plants, our environment. And that if we work on AMR, and that is exacerbated by climate change and how it requires us to act simultaneously to mitigate climate change, AMR, and ensure that WASH is being optimized. I hope I've captured everything. My group is welcome to add more. Thank you.
Thank you very much for that overview. Sounds really like an interesting and engaging discussion. Moving on to group number 2, looking at the challenge from the WASH angle. Isabel, how did your discussion go?
Yes, thank you, Nikolai. Well, we had some discussion. We didn't have as much discussion as I would have hoped for, but I would like to share some of the key points that were presented and some of my closing remarks. So in summary, for our group, WASH as a risk or containment factor for infectious diseases and learning from COVID. We've seen that it is vital to improve hygiene and provide safer water and sanitation and better wastewater treatment to reduce the dependence on antibiotics and contain infectious diseases in general. In our study, we have seen that despite large regional and national disparities, there are also some commonalities. Initiatives that relate to the intensification of behavior change and awareness raising campaigns for the promotion of hand washing and other IPC measures are widespread and have been widely adopted. Many countries have also implemented a combination of technical and financial measures to ensure basic WASH needs for vulnerable groups and key institutions, but they will not suffice to reach all the population in need. Looking forward, as the vaccination campaigns are gradually rolling out and immunization rate increases, the nature of the response of the pandemic needs to evolve as well accordingly towards more resilient services. The world must recognize that leave no one behind principle of the SDGs to ensure the status of those most vulnerable is taken into account when recovering and rebuilding from the months and years to come. Also, measures need to be taken at the highest levels of governments alongside with financial support, planning, and capacity building for effectively achieving this objective. And finally, the critical importance of WASH services for society has been demonstrated once again. It is time to use the learnings of this crisis to better be prepared for the future. Thank you.
Thank you very much, Isabel. That's also yet again another important, let's say, call to action, even from that angle. The group number 3, human health. Philip Matthew, how did your discussion go?
It was wonderful, actually. We were a small group, only 6 of us, but then the discussion was quite robust. We decided to discuss only one aspect of the human health angle of WASH, AMR, and climate change because of obvious lack of time. So we decided to focus on how to communicate about this issue, who are the possible targets for communication efforts. The broad consensus was we probably need to look at the conventional targets like funders, development partners, possibly prescribers of antibiotics. But then a very critical factor is people working in sanitation engineering, environmental groups working on the ground, people working to improve the WASH infrastructure, and more so communities, local communities needs to be engaged with this. And other potential targets can include global organizations of professionals and students, and community leaders, which possibly have a certain level of credibility on the ground. The messaging frames, just like climate change, AMR also is actually facing a narrative challenge. People see AMR and climate change as very distant issues, which are quite far away and may not affect them in their lifetimes. But then that is not true. We need to make sure that it is not framed as a faraway problem, a very technical problem. And the messaging should focus on very, very simple things that can improve their competencies to identify and take action. There was a consensus that the solutions are not very complex. For example, provision of running water facilities in healthcare institutions, or composting to reduce antibiotic residues. These are not very complex resource-intensive things. Of course, there are very complex resource-intensive stuff, but there are certain things which communities can act on. So that should be a focus of messaging around this particular issue, because otherwise local communities won't act on this, and then the solution will be far away. And the most important point which was highlighted was the importance of people working together, the intersectoral coordination, for example, healthcare professionals and the sanitation engineering department to be working together to create solutions. Now, these work as different silos, and that is actually a problem. And I think the take-home message that we have from our small discussion was we should be able to enable communities to understand and act on this issue, because many problems can actually be solved locally. Be it the problem with WASH or disposal of healthcare waste. Many things can be solved locally, and people should start talking to each other and working together. And the focus should be on key behavioral change. From each stakeholder groups, what can be the positive behavior which can be expected. And lastly, I think healthcare professionals, or rather healthcare workers, form a key entry point, and they should be trained and sensitized first before moving out into other key stakeholder populations. Thank you.
Great, thank you very much. I will move on directly to the next group, and that is animal health, led by Christina Osbier.
Thank you very much, Nikolai. We had a very engaging discussion in our group. It was a small group. We focused very much on low and middle income countries. What we came up with was that national conditions will have very much to define the needs to adapt to climate change, and that we know that AMR is increasing with the higher temperatures. And in the past, animals have been very scarcely addressed in the climate change mitigation, and animals have to get a larger focus when it comes to mitigation to climate change. We also know that antibiotics are widely used in animals in many low-income countries. That came up and was confirmed with the members of the group, but the monitoring of antimicrobial use is very scarce. In many of the lower middle-income countries, there was figures of 10% of low middle-income countries have a functional monitoring system. So it's difficult to say if there is an increase or decrease. It would take years to actually have that data to look at. And also that regulations and good practices on antimicrobial use are coming more and more in animals in low and middle income countries, but we don't know yet the impact of those, since we need to have robust monitoring systems, both of antimicrobial use, but also of antimicrobial resistance, to tell if there's an impact of the current changes in practices and regulation. Also, safe management of animal waste was confirmed to be an issue in all types of farms, both from the extensive animal farming to the medium-sized farms and the larger scale farms. And communities don't seem always to be aware of the risk posed with animal waste. It seems to be more well known with the risk posed from human waste. So there is a need really to expand the knowledge in communities on the risk and safe management of animal waste. We also discussed the wastewater from animal slaughtering. That is a big issue in many countries that we don't really know how big that risk is. And there was an example of a zero defecation program in humans that hasn't really gained expected impact. But if we can include animals in that and look at the management of animal waste, we might actually have possibilities of having a larger impact of such programs. So in conclusion, we need more integrated studies. And since there is a scarcity of data on the risk and the benefits posted by including animals and animal waste to ensure that we really address human, animal, and environmental health in low and middle income countries. Over. I hope I captured all.
Thank you very much. I'll squeeze in this message here. I see there is already quite some dynamic in the chat. If you go through the event platform to the page of this session, please keep using the chat also after the event. I think that can be an interesting discussion platform. And we'll also be sharing. You'll already find quite a few resources there. We'll clarify which slides we can share, and we'll definitely share some conclusions there. So check into the event page once in a while. There will be more going on, I guess. Now I'm jumping in for the environmental health group. Also there, a small and dedicated group where we touched a little bit upon different areas, because we felt that the environmental health component also, in a nutshell, boiled down, if you take the water lens, to understanding the role of aquatic ecosystems as a reservoir, but also as a vector for both the antibiotics and the resistance genes, is not fully understood. And monitoring is definitely a bottleneck. Also understanding and defining science-based targets on safe discharge limits, safe levels of prevalence and concentrations and so on. But on the other hand, and I think this is also referring to many of the references that other reporters or rapporteurs made here to the climate debate, we do know enough to start acting. And many of the solutions might not necessarily be so massive and it's not that we don't know what to do, but that we're lacking a cross-sectoral approach and collaboration. That in a graphic that we looked at, kind of the silos almost jump out of that picture, and reconfirming where these barriers might be, rather than in the cross-sectoral collaboration, rather than understanding what to do. And I think that also helps, picking up a few words from the other groups, that it boils down to the awareness, but also the empowerment and the operating space for the respective stakeholders to actually live up to the responsibility they could have if they were equipped to that. I'll stop here and hand over to the sixth group on corporate responsibility. Maria.
Nikolai. We also had a small group. Obviously, this is an area that's probably not as familiar to others. We didn't have any other investors in our group, but many sort of vets, academics, etc. And I think the key takeaway was really that we need more corporate or business incentives to address AMR risks and disclosure. Obviously, that's where FAIR would be quite helpful. We need more research on complex issues. For example, how will we discussed briefly and didn't necessarily have an answer, and we got cut off. Like, how can sort of antibiotic effluents in water risk affect productivity further down the value chain? So, for example, workers at certain companies who perhaps use a lot of water in their production, how can we educate and assess that risk to the workers community? We talked about the lack of governance in emerging markets and the challenge to, educate corporates and even local communities. A lot of times there's lack of incentive from governments, lack of incentive from industry, and certainly then lack of incentive from the underlying market, where antibiotic use is probably the easiest way to be able to address illness in flocks and herds. And lobbying groups play a big part there, and that it's safe to say that's an issue in developing and developed markets. I mean, even through our own research, I think we saw that even in the UK and the US, lobbying by the animal health sector has doubled over the past 2 or 3 years. So, I mean, that will always be, a key issue. We discussed, again, this idea of incentivization, of how do we get companies to understand what the right thing to do with their product. Colistin was used as an example, if that's their key revenue stream, again, and how do we do that in the face of sort of government inaction and the lobbying community. We also spoke about trade restrictions. Is that going to be a key lever of change? And obviously, I think we all hope it is. So we've already seen some examples that has happened from COVID, or at least in the meat industry. And I cited an example that I know from a Brazilian meat company who's had antibiotic residue on some of their meat, and therefore wasn't able to COVID residue on their meat, and they weren't able to enter into the EU. Hopefully, the more stringent EU regulation will cause some of the companies even to perk up their ears even more, with the risk of not being able to access these markets. And we're having these discussions with companies now. And obviously that could be a significant lever of change. And that's really it. There's much interest in understanding how to engage with the private sector and corporates. I guess few people in the market are doing that in the same way that institutional investors are doing it. And we welcome any more questions for myself or Maggie, who again works with Nordea, if anybody wants to understand how they might be able to best leverage these actors or stakeholders. Thank you.
Thank you very much. And thank you all for volunteering to facilitate these breakout groups and reporting back from them. I think we've heard really, let's say, it helps understanding the challenge, but it also helps seeing the connectivity, how that boils down to quite comparable messages, irrespective of the different character of the groups you had. Some more really on the scientific foundation of understanding the challenge, with the last group on corporate responsibility, really targeting a specific stakeholder group. We had quite different characters, still coming back to a common denominator that I read in all the reporting back is about, it's a behavioral change we need to achieve. And that is, of course, a comparable diagnosis to all kinds of global challenges. We do know enough to start acting. Communication seems to be a key issue, but also providing the enabling conditions based on specific national conditions. There isn't, on the one hand, no one-size-fits-all solution, obviously, but on the other hand, I think there is space for quite a generic or universal toolbox that can help addressing these issues, bringing together the relevant stakeholders from the healthcare side, from the water and water utility side, but it brings in the learning from climate change, how long this takes and how much knowledge can only drive this change to a certain extent. And I think now this is really a time where bringing together these perspectives and seeing how can this lead to alliances that provide a more universal approach to this, and not getting stuck in these often quoted silos. That's really one of the challenges that I hear from all the groups as a kind of common denominator. Thank you all very much. I am now handing over for closing remarks to Eric Vennant from the rollback antibiotic resistance initiative in Tanzania. And as I said earlier, for us, it's really important to provide multiple perspectives on this challenge. And we have seen the perspectives now from different scientific disciplines, from different stakeholders. But as with the movie about the children, we want to also take an intergenerational perspective. And the rollback antimicrobial resistance initiative is really, it's a young network that we have come in contact with, who brings together really inspiring, engaging young people working in this field of AMR. Before giving the word to Eric, I also have to say that I have a scheduling challenge, meaning that I have to be preparing the next session that starts back to back with this one. So I will leave the session now, unfortunately. And I'm very grateful for our partner at CIANI and the Stockholm Environment Institute, Madeleine Fogde, to then close the session after Eric's remarks. But to start with, Eric Vanant from the Rollback Antimicrobial Resistance Initiative in Tanzania. Thanks for joining us, and we're looking forward to your reflections on what has been said.
Thank you very much, Nikolai and Siwi, for the invitation. And I would also like to thank all participants, facilitators, for the really active session, which we had. So chance of giving out the closing remarks. And because I am a young professional and young people are already powerful advocates on other One Health issues, including the climate change. However, their voices are not yet being heard on antimicrobial resistance. And youths already recognize that they have a unique role to play in combating antimicrobial resistance, but they do not feel sufficiently empowered to advocate for the issue. So we really think that if young people, young professionals, should be part of the governance and decision making in relating to the fight against the antimicrobial resistance, both at the national and also at the global level. So if the young generation are well involved in tackling antimicrobial resistance, it will really accelerate the implementation of national action plans on antimicrobial resistance. And also it will accelerate the implementation of global action plan, global AMR action plan. But also it will stimulate the innovative solutions from the young generation. From the sessions, I think we have been able to see how One has remained at the key approach in tackling antimicrobial resistance, because we really want to tackle AMR from all angles, from the human health, from the animal health, and also from the environment sector. So we should really keep emphasizing on the using of One Health approach. But also, today is the last day of the World Water Week. So I think the governments and other stakeholders should increase the investments in improving the wash infrastructures and ensuring the safe and clean water, so as to prevent the spread of resistant infections, and also to reduce and minimize the use of antimicrobials, especially antibiotics. However, the meaningful engagement of young people in AMR issue will increase innovative solutions, as I said before, but I would like to emphasize on raising awareness, increasing the understanding of these key issues, specifically antimicrobial resistance, and also linking it to other world-pressing health issues like climate changes, but also the focus on behavioral change. as we emphasize on coming with new antibiotics, but we should also keep on preserving what we are having. So that's why emphasizing on behavioral change through increasing the knowledge and understanding remain as a critical step in tackling antimicrobial resistance. So I would really like to insist on the policies which will engage young people and young professionals in the area of antimicrobial resistance from the national level and also from the global level. We have learned from the COVID pandemic, and AMR is always being called as a silent pandemic, but I think it's not. It's no more a silent pandemic. AMR is already happening, and there are data which really show that it's really affecting not only health consequences, but also in the economic sector. So I think the different stakeholders, different players, we should build the momentum from the lessons which we have learned from COVID, and then build the momentum in tackling antimicrobial resistance to prevent further consequences and also the emergence of resistant organisms and also the spread of resistance organisms. So I think that's what I really wanted to emphasize. And I hope this event will further build the momentum on tackling AMR in all sectors, human sector, animal sector, and the environment sector. And also it's a call for empowering, having a meaningful engagement of the young generation who are really playing a great role in the communities, and perhaps are always acting as caregivers to the older people and also to the children, which are really vulnerable, as we have seen in the previous reactive video. So we really need to have many young leaders in AMR sector. And just to finish, I think we should keep on engaging the community and the local community in all these issues, the climate change and the AMR issue, and also keep improving on wash structures so as to mitigate all these. Having said that, I would end by saying that this event was like a call to build a momentum to all stakeholders across all sectors to keep the momentum on improving wash infrastructures, on assuring the access of clean and safe water so that to reduce the spreading of infections and so that to avoid the effects of AMR and climate change. Thank you very much, and good luck to all the interventions and the efforts which we keep taking. Thank you very much.
Thank you very much, Eric. That was a wonderful and strong reflection from the youth and a call to all of us to continue to collaborate and to build these strong collaborations. My name is Madeleine Fogde, and I work with SIANI, Swedish International Agriculture Network Initiative, and we are hosted at Stockholm Environment Institute. I have also a solid and very long background in sustainable sanitation solutions. It is my pleasure to close this session now, and to, I'm not closing because Eric did that very well, but I would like to thank everyone who has been involved in making this session very interesting. It's one of the last this Water Week, and it has brought us a lot of learnings. It has also indicated that we have a lot more to do, we have a lot more to explore, and that there are quite big connections between climate change and AMR and WASH, and there are also similarities, but now it's the time for action, and that goes for me and you and everyone else that has knowledge. We need to contribute and to do things. We can learn from climate change. We need to do it now. We need political engagement. We need the researchers. We need the practitioners. We need the communities. And we need to do this for the youth, and the youth has to be with us, but we have to do it for future generations. We have been running these seminars since 2016 at World Water Week. We did not know much at that time about the connections between AMR and WASH, but we suspected that there were strong ones. Now we know much more. We have been every year try to address different topics. And this year it was very pertinent and also very urgent to connect it with climate change. And we have learned so much thanks to Professor Sabila. And even more interesting is to see how the private sector is coming along and how WEF now is putting numbers on this. This makes the traction for politicians much more higher. They are more interested when we know the numbers. The numbers are staggering and we need to act. And as it is also World Water Week, when we discuss water and sanitation, I would like you also to remember that still with new topics and climate change going on and the AMR, we have still 4.2 billion people that do not have adequate sanitation. And that condition is actually putting a threat. And unless we solve that, we will have to work so much more on AMR and the spread of antibiotics. So this is really a call for safe water and sanitation facilities for all people. Now, so thank you all. I hope that the organizers of this event, SIDA, Nordea, REACT, SLU, Siani, and CIVI, will join hands again and have this annual, should I say, webinar or seminar at World Water Week, so that we will meet next year again and bring with us more knowledge from the different fields that we have been discussing today. So thank you all for being here today, for sharing your knowledge, and for bringing forward this very important topic. I think I will close here, and if there are any last questions, or I will let you interact on the platform a little bit more so that we do this in respect of time. Thank you all for joining us. Yeah, thank you.
Thank you.
Thank you.